Hi, I'm Dr. Jeffrey Lewis, Medical Director at Racker, and today we're going to talk about your favorite subject, COVID-19 vaccines. Today I'm going to sit down and have a conversation with Bob Brazil, Racker's Director of Community Relations and Development, so we can share some personal stories about our own experiences with the vaccines, situations with family members, and to go over a series of questions that both of us have been hearing pretty frequently lately. And hopefully we can dispel some of the residual myths and rumors about the vaccines. So I'm here with Bob Brazil, and I'm going to ask Bob to start with a conversation about what we've done at Racker as a whole to help protect our staff and the people that we serve. And then we'll get into some questions and back and forths and a conversation about our own personal experiences. So go ahead, Bob.
Sure. Thanks, Dr. Lewis. Throughout this difficult year, Racker has taken every precaution we can to prevent the spread of the virus in our programs, in particular our residential program. All staff have been required to wear PPE masks. We sought them out when they were very scarce, and that's to protect you, your family, your friends, in particular our residents in our houses. Unfortunately, about 10 months into the pandemic, the virus found its way into one of the houses. This led to 2 deaths in that house. These deaths were tragic and devastating to their family and to the staff that worked with them.
So Bob, I'd like to talk briefly about my own experience in getting the vaccine and also share some stories about family members. Before vaccines were available, I had several nieces and nephews who contracted COVID. Fortunately, they were all young and healthy, and most of them recovered pretty quickly without any residual. 2 of them did have some prolonged effects, which were pretty troublesome, but have recovered. All of them went on to get vaccinated once the vaccine was available. I decided to get the vaccine when I was eligible as soon as I saw enough data to make me comfortable that the science was secure. And so I wasn't an early enthusiast at the very beginning. I wanted to see actual data. But once I was eligible, it was clear to me that the data was sound and that these were safe and very, very effective. So I've been vaccinated, my wife has been vaccinated, my 24-year-old child and my 20-year-old child have been vaccinated, all my nieces and nephews, my elderly parents, my 96-year-old mother-in-law, and everyone's fared very, very well with the vaccines, and we fortunately have been able to stay healthy since getting the vaccine.
That's important. The time of when the vaccine came out was really crucial for a lot of people. I know from my personal experience, we lost a family member about 2 weeks after he was eligible. He was over 75 years old and unfortunately passed away within 3 days of contracting the coronavirus. It was devastating for us, just the timing of it all, but the vaccine, if he had been able to get it, he'd still be here with us today. Dr. Lewis, let me ask you some questions that we're hearing from the Racker community on some hesitancy to receive the vaccine and some of the questions that are involved with making that decision to get the vaccine.
Sure.
The first one that we've heard a lot about is issues with women and hesitancy to get the vaccine with pregnancy or breastfeeding, mammograms, all sort of health issues related to the female population. Do you care to discuss that?
Sure. I mean, that's a whole category which has to do with fertility, miscarriage rates, and things like that. And so now we have enough time since the initiation of vaccinations, including the studies that were done prior to that, to have real data. And what's very clear is that the pregnancy rate is exactly the same between those who get vaccinated and those who don't. The miscarriage rate is exactly the same, so this does not lead to a higher incidence of miscarriages. That pregnancies carried all the way through to birth seem to be no more eventful in any way than those who do not get vaccinated. So in terms of concern, and I've had this question asked to me by my own daughter, she was concerned, well, what if this will make me infertile in the future and she wants to have children? So I dove deeply into the data that was available, and I told her I wasn't concerned about that based on actual scientific data. And so she has been vaccinated and is happy to do so because it's liberated her socially since she's at college.
And you talk about actual scientific data. The biggest question that we're always hearing, is it safe?
Yeah, that's an interesting one. This is probably the safest vaccine of any that I've experienced, not only as a physician, but growing up as a child. If you look at the statistical outcomes, it's more effective than almost any of the other vaccines, especially if we're looking at Moderna and Pfizer. 95 to 97% effective rate. And in terms of side effects, people sometimes don't feel well for a few days after getting, especially the second vaccine. But in terms of full recovery and then being healthy after that, it's extremely safe. Safer than most of the vaccines that all of us have gotten just so that we're eligible to go to school, for comparison.
With that said, once a person is vaccinated, are they able to transmit the virus to other people around them?
The reality is, if you believe the science and effectiveness, which is 95 to 97% effectiveness, the likelihood of you being able to spread virus is extraordinarily low. And it's multiplied if you're with somebody else who's been fully vaccinated. So as a result, I feel perfectly comfortable not wearing a mask and having dinner with friends when all of us have been vaccinated and have done so.
And following the vaccination, how long does that immunity last for? Am I going to need a booster?
So it's early, it's a little too early to say for sure. My feeling is that the recommendations will be to get an annual booster. Right now, it looks like the effectiveness and longevity of immunity is at least 9 months. When more time passes, we'll know better. I'm also seeing some studies that suggest that the immunity will be about a year for the vaccinations.
So if somebody has a medical condition or allergies and they're hesitant to get the vaccine, what advice would you give them?
The advice I would give for that would be the same advice I would give for any other vaccination or even any other medication, treatment, screening test, or whatever. It's really important, since every person is different, we're not all exactly the same, to discuss that with a primary care physician and express those specific concerns to the primary care physician when asking that question.
So for people that have already had the virus, who have contracted COVID-19 since the start of this, when it hit in February and March, should they still get the vaccine even though they've had COVID?
For those who have recovered from coronavirus and then get vaccinated, it looks like the immune response and keeping antibody levels high for a prolonged period of time is pretty favorable.
So there are instances in the community where people still get COVID-19 after getting vaccinated. How does that happen, and why should they get vaccinated if they can still get COVID-19?
That's a great question. I think in most cases what we're seeing is that they're getting sick with coronavirus in the interim period between getting the shot and developing immunity. So we have to remember that if you're, say, getting the Moderna or Pfizer, you get your first shot, you then have to wait 2 or 3 weeks to get the second shot, and then you have to wait another 2 to 3 weeks to be fully immune. So while the first shot does confer some immunity, there's still a significant percentage of people who can still contract the virus. And even after the second shot, it takes a few weeks. So most of the cases that we're seeing of positive coronavirus after vaccination are during that interim period.
Now we're seeing all over the world different variants pop up in places like Brazil and the UK variant. How does the vaccination that we're taking now in the US protect us against those?
So it looks like those who have immunity from getting the vaccinations are at least partially protected from these new variants. That's what it looks like so far. And in a way, you can look at this as very similar to flu vaccines. If you get the flu vaccine, and even if the strain that you got is not what's spreading around, you can still get the flu, but you tend to get a much more mild version of it. And so that's what we're expecting with the COVID situations and the variants. There may be some variants where there's very little protection conferred by the vaccine, and that's probably why we're going to be seeing recommendations for boosters every year with subtle changes in the spike protein antibody response.
So as Racker's medical director and our expert on all things medical here in the organization, you've probably come across a lot of questions that I'm not going to come up with today. What are some questions that you've seen out in the Racker community or in the community as a whole that you'd like to address?
Well, one of those would be conspiracy theories. There's no microchipping going on with these vaccines. The structure of the vaccines, these molecules are extremely small. The messenger RNA in the mRNA platform viruses are gone out of your body within hours of getting injected, and there's no room for microchipping. So that's one that we can dispel for sure. One other thought I'd like to offer about the decision to get vaccinated is there's a selfish reason to do it, and then there's a responsibility to other people that live in your community. The selfish reason is, I'm going to get vaccinated so I don't get sick. In my case, I certainly didn't want to become sick with coronavirus and really didn't want to become a long hauler. I enjoy good health, I like feeling good, and the prospect of being sick with the flu-like symptoms or respiratory problems for months and months on end led me to feel much more comfortable getting the vaccine once I knew it was safe and effective. But I think we all have some social responsibility to other people as well. We live in society where we should feel some social responsibility. And so even if you're very comfortable that you would get the virus, get sick and recover, or be an asymptomatic receiver of the virus, you can still spread it to others. And that's really the issue of concern at Racker, especially in our residential program, is of course we care about our workers, and that's why we've done all the measures that we have to protect people before the vaccines were available. We don't want any of our employees getting sick. But we also should feel a responsibility to protect our residents. So there's the selfish reason, which we should all feel great about, but there should also be an element of social responsibility. And that's another reason why I pursued getting vaccinated and encourage my family members to do as well.
Yeah, and as we touched on earlier in our conversation, we did have a case in one of the houses, and it's been documented that individuals with disabilities have a lot of comorbidities that makes them more susceptible for getting really, really sick.
That's right. Individuals with intellectual and developmental disabilities over the age of 40 have 4 times as many chronic and progressive medical problems as those who don't have intellectual and developmental disabilities. So our residents are by nature an at-risk, elevated risk population of folks, and that's why we're working extra hard to do our best to protect them.
It also should be noted that both Dr. Lewis and I have both cleared our second week of our second dose of the vaccine, which is why we're talking today without our masks, socially distanced. But it's important to emphasize that we are able to not wear masks and be socially distanced because of the vaccine that we received.
Well, thanks, Bob, for having the conversation. I hope that what we've been able to do today is to clear up some confusion about things related to the vaccines, give a sense of clarity for those who are on the fence. And as I always say, I'm not here to tell people what to do because I don't like being told what to do myself. But I do feel a responsibility to educate people so they can make the best decision for themselves and to do their best to protect others.
That's great. Well, thank you so much. This has been very enlightening, and we really appreciate you taking the time.
Thanks, Bob.